The federal government is now pledging more than $1 billion towards finding a cure for COVID-19. $115 million will be spent on research into vaccines and treatments. $662 million will go toward clinical trials across the country. And $350 million will increase the number of people being tested for the disease. Dr. Mona Nemer is on the task force, which will be leading these efforts, and she joins me now. Doctor, thank you so much for joining us today. Let's get right into it. What will be the first thing you prioritize in this task force?
Well, the first one is really, first of all, good morning, Ben and everyone. The first thing that we're going to prioritize is the design itself of the study. This is a study that's going to involve getting blood from Canadians across the country to look for antibodies which are going to give us an indication that people have been exposed or not to the virus. So it's very important to have the proper design to be able to compare the data across the country, and of course to choose also the right test that will be valid and reliable for the coming months.
Now, the goals of the task force are lofty. How are you going to test 1 million people across this country over 2 years?
Well, we haven't really done all the design yet. We're waiting to meet, but there are a number of avenues that you can take. There are a number already of very well-studied cohorts, groups of people across the country that are part of other studies for cancer treatment or longevity studies or other pediatric cohorts as well. And then you can do as well random testing, be it for blood donors, a hospital setting, even shopping center settings. It's been suggested when those open. So there are a number of ways to do it.
Doctor, do you have a date circled on the calendar for when you want to have a vaccine or a treatment available? Is there a deadline?
Well, we all want to have it yesterday, right? But the reality is that it takes a long time to develop a vaccine that can be produced and for mass vaccination. The other thing is, vaccine development is not an exact science. You never know. Remember HIV, we've been looking for a vaccine now for over 20 years. We still don't have one. In other cases, we luck out, like in the case of Ebola and others. So we're really hoping that we'll have some indications in the coming perhaps 6 months or so. And in the meanwhile, I think that we're going to need to understand better the disease, understand better who has been infected, and whether infection actually provides you immunity against reinfection.
Dr. Mona Nemer, thank you to you and your team. You have a huge job ahead of you. We wish you the very best of luck.
Thank you. We're going to need it.
Thanks for watching. If you like this, be sure to subscribe here.
And you can check out more Your Morning videos right here.